Hello, my name is Craig Nash, and I'd like to welcome you to another It's a Grand Life. And I think you're just going to be blessed with our guest for this podcast. Oftentimes when life throws you a curve and you enter into a new setting and a new arrangement, i.e., becoming having a grand family as opposed to just being grandparents, you never know some of the blessings you're going to find along the way. And for my wife, Kathy, and I, we have been so blessed with some of the parents and principals and school administrators and what have you that we've met at our granddaughter Grace's school. And one of those parents is our guest today, Dr. Julie Braciszewski, who is the founder and director of Monarch Behavioral Health. And she and I were on a field trip, believe it or not, at our state capitol here in Michigan. And I said, we had so much fun. And we started to talk about what she did for a living. And I just thought this was really going to be a blessing to our grand family. So Julie, welcome to It's a Grand Life. And I'd love to have you share with us a little bit about your background and what led you to Monarch and a little bit about this outstanding practice you have.
Well, thank you. And thank you also for the opportunity to be able to do this, in that being able to do this and give this information is a blessing to us, and that in our organization, one of the things we try to do is give away as much intervention and information as is humanly possible. And the only way we can do that is when we're kind of invited and called to the carpet to do that. So thank you so much for giving me the opportunity to kind of live that value and that goal out. Our practice is an outpatient behavioral health center, and we see people across the age span, all the way from some prenatal care for mamas and all the way, through adulthood and aged individuals and all the family in between. So we have a number of clinicians, doctoral PhD level clinical psychologists, as well as master's level psychologists. And we provide a wide range of services, including individual treatment and family treatment, everything that runs the gamut for emotional and behavioral health. And we also do testing services. So evaluation services, psychoeducational evaluation and neuropsychological evaluation for issues that run the gamut from ADHD, learning disabilities, autism, understanding how anxiety might be playing into difficulties functioning, wide range of evaluation strategies for really good diagnostics. So making the correct diagnosis and lining up the best, most effective plan once the diagnosis is made. We engage in therapy without doing the full evaluation services, but oftentimes when somebody comes in looking for an evaluation, we then provide services following up.
So the one of the unique things about Monarch Behavioral Health that hit me was this real emphasis on the neuropsychological testing. There are a lot of places you can get a one-on-one relationship with a professional psychotherapist, but you guys go as an additional step, and you're really concerned about making sure you have the right diagnosis for whatever the patient is dealing with. And how does that normally work in your practice?
Well, and I think we started that in that I've seen so many times kind of anecdotally of, kiddos and adults who did not carry the correct diagnosis. There was more underneath what was going on that we honestly cannot understand until we have standardized data. Something about me personally is I'm a big research nerd. And so I want to look at the data. And oftentimes for people, the data puts us on the right path. And so the process of an evaluation, first, there's the intake appointment. So you come in and parents or grandparents oftentimes do that appointment alone without a child present. And we do what's called a neurodevelopmental interview. So we get all the goods, all the information about what's going on, when did it start to develop, and really, especially for kiddos with kind of more complex histories, we really want to get all the information about what has gone on so that we can understand how those complex histories might be affecting them. We then At the next appointment, bring the kiddo in, and that's usually the testing appointment. And testing is really just activities. Some of them we're up and moving around the room. So a lot of them we are sitting at a desk kind of across from each other, and we're playing games and doing puzzles. We're asking questions that the kiddo then tries to answer. Some of it is super easy and is designed to be easy. And some of it is really challenging and hard, and that's also good. It can last anywhere from 4 to 6, 7 hours. Sometimes we have to do 2 sessions. And then we wrap up that day. We score everything and get all that juicy, great data. We compile it, and then we have a feedback appointment. And depending on the kiddo's age and their disposition and kind of who they are, oftentimes we do the feedback only with parents or grandparents. And then sometimes, though, for instance, with a teen, the child or teen is in on that feedback as well. And at that third appointment, that feedback appointment, we talk about everything that's going on, as well as the diagnoses and the recommendations moving forward. Oftentimes, when you're getting an evaluation somewhere, the service kind of stops there. You do the feedback, you get the list of recommendations, and you're on your way. We try really hard when parents or grandparents want us to, we advocate beyond that point. And so something else that we do is we are often going, for instance, into pediatricians' offices or having those phone calls over Zoom or just telephone to explain the results and what needs to happen medically, in our opinion, next, kind of what path that physician might look down to provide their level of care. Other times we are going into schools. I've been in a lot of schools the last couple of weeks doing all those individual education plan re-ups and reevaluations to explain to staff and school, what does this mean and how does this kiddo learn best and what can we do to support them? And so we follow after, as long as, parents, grandparents want us to provide those services, and certainly therapeutic services when necessary and indicated.
Now, Dr. Julie, when you have a child come in and the caregiver, whether it's the parent or the grandparent, you ever find that you're starting with the child, but you end up actually helping the parent or grandparent as well? Because things are identified that maybe the grandparent's not getting the testing, but things come out during the interfacing with yourself or your team members that, there's more here than just chatting with little Johnny.
Oh, absolutely. And I would say maybe even the majority of the time. I think if you do a testing, an evaluation, and you're only focused very narrowly on the child that is in front of you rather than the whole context that they are existing in, you're probably not going to get very far. So what we want to do then is provide parents and grandparents the support to be able to provide parenting to that child. As parents, we often find ourselves, our own disposition and skill set and experiences might not be well suited or matched with the beautiful kid that's unfolding in front of us. And so to bring on board some skills or perspectives, some strategies, oh my gosh, it can be a lifesaver. And so we often do in our recommendations, and also in therapy, we do parent-centered support for whatever is going on. And sometimes we absolutely do refer parents or grandparents to their own services, because it's kind of the oxygen mask, saying we have to put on our own mask before we can put on our kiddos. If we're overwhelmed and just drowning and anxious or depressed and not functioning well, it's extremely hard to parent. And so sometimes we refer parents and grandparents. Absolutely, we want to match them up with the right services as well.
And I would imagine with all your experience and with all your team's experience, you can probably gauge pretty quickly if a caregiver's overwhelmed when they're coming in to see you. And
some people hide it really well. They do. Type A personalities, high achievers. They sometimes hide it really well, but we try and ask the right questions to get the answers that help us understand what is that mental and physical load you're dealing with.
and they've got to be comfortable with your team or yourself so they open up. But now, when we're talking about these very clever young folks that you guys deal with, how do you know when they're giving you the gospel or just pulling your leg?
Yeah, well, and that's also why I like the standardized data, because when we're doing testing, it is true that I think you can Google, you can really go down the rabbit hole and Google almost any diagnosis and come up with the symptoms. And we do often have like middle schoolers and high schoolers, especially coming in, having done their own research and feel very strongly about a particular diagnosis. But the type of tests that we do and the activities that we do, kiddos don't always know exactly what they're being scored on or what element that test is testing. The type of tests we use are very sensitive to the things we are trying to diagnose. And the test also, when a kid is, for instance, not giving full effort or trying to appear a certain way, the test is very sensitive, and we can tell when they're trying to do that most of the time.
That is good news for our grandparent listeners. I'm sure of that, because they know these kids can be very creative. And if you've just joined us, our guest today on It's a Grand Life is Dr. Julie Braciszewski from Monarch Behavioral Health in Bloomfield Hills, Michigan. If you want to find out more about this outstanding practice, just go to their website, mbh-mi.com. And Dr. Julie, what led you to take Monarch into a focus beyond just the treating, but also into the testing? What led you to expand it?
I think it has to do with my initial training, as well as the follow. So I did my PhD at Wayne State and then went to the postdoc. I did internship at Hawthorne Center right in Northville, and then postdoc at Brown, at the med school in Brown. And evaluation and taking an evidence-based approach to treatment was really always part of my training. And so it felt just very, this is what we do. And so it felt very second nature, kind of backing all the way up to undergrad, which is now forever ago.
We won't ask.
How many decades ago now? When I was at U of M, I had the awesome experience of doing something called Drop Undergraduate Research Opportunity. And I was in a lab testing the genetic coding for, this is gross, but you break rats' jaws and you separate them, and you're trying to help kids actually with cleft palate. How can we figure out how to make the bones grow without having so many surgeries? And part of the experience was doing questionnaires after we dealt with the lab side and the rats, part of the research was also going and dealing with real kids in the hospital. And what I found, I was so interested in, these kids being in and out of school, and the neurocognitive correlates that often go along with cleft palate. And I found myself trying to help these families put together plans to help their kid reintegrate into school after so many surgeries. And it was fascinating and complicated and messy. And probably my first experience of trying to integrate kind of data and standardized approach with the messiness of being human and our emotions and our behaviors and our histories. And it's just fascinating.
It absolutely is, and but it just everything you're saying reminds me of this line on your website that really highlights the difference in Monarch, which I want our audience to understand. But at Monarch Behavioral Health, you provide compassionate, confidential care. That's not unique. A lot of people do compassionate care, but it's rooted in sound scientific research. And our mission is to develop psychological treatment and testing services that help you and your family create lasting change. That's what folks want. They want if I'm going to have this interaction with the professionals at Monarch, is it going to generate the type of outcomes for my child or grandchild or loved one that's going to have sustainable change? And that's what you're talking about with data. You really get to the bottom of what's going on, and then you can address the life situation for the individual. I love that.
Well, and you picked out of all because you can tell on our website, I'm wordy always. You picked a phrase that does exemplify what I feel is so important. In a perfect world, I wouldn't exist. I wouldn't have to do this job. If I can work myself out of a job, then I have done it. And that I want change to be sustainable.
Yes.
I want every testing we do is created, and our reports are sometimes exhaustively long, because we're creating a legal document, a report that goes with you and explains not just at this grade, but throughout college and to every physician that you see, and so that the data moves with you and is sustainable, and the change is efficient and sustainable. And part of what I mean by that is when we do testing, we do a very comprehensive testing. For instance, if somebody comes in and says, I think my kiddo might have ADHD. And we also say, let's say there might be a history of some type of trauma in the past. And so we also say, actually, trauma really affects your attention span and your memory and your ability to engage in something called executive functioning, which is right up here in the frontal lobe. And so very complex. We have to say, okay, are these issues and difficulties due to trauma or ADHD? And then we might do the testing. And because we do a very complete testing, we might say, oh my gosh, actually, this kid is suffering from anxiety due to trauma, but they actually have dyslexia. So most kids that have dyslexia actually read at a low average to average range. And it's the constituent neurocognitive processes underneath the reading that we test. And that kid who's having trouble decoding words and encoding, which means taking it from here and writing it down. And when there's glitches in that process, oh my gosh, it's impossible to pay attention in school. And you're going to get inattentive and you're going to get silly or disruptive. And then if that disruption is rewarding, oh, forget about it. Now we're really on that train. And so the sustainable intervention for that is actually an IEP, so individual education plan at school for dyslexia versus treatment for ADHD. The sustainable plan is getting the structure in place educationally that will take course over their entire educational career. Even through college, we get accommodations for dyslexia. And so exactly that sustainable change that creates change that puts a kiddo on a whole other path, and gives them everything that they need to really fulfill their full potential.
There's another factor in there. I think when you're able to identify exactly what the patient is dealing with, you really can reduce a lot of unneeded costs in the care of the patient. And my background prior to doing this podcast was at a company that did complex care management for high-risk patients. They're in and out of the hospital every 2 seconds for a variety of reasons, many of which could be behavioral health related. But once we build a relationship with the patient, we're able to really identify what was going on with the patient. For folks with multiple comorbidities, we were able to reduce readmissions and reduce costs by $40,000 per patient on an annualized basis. You can get a lot of behavioral health testing and behavioral health visits for $40,000 per patient saved.
Yeah.
And
Yeah.
So if you identify, Dr. Julie, a patient has dyslexia as opposed to ADHD, doesn't that reduce the multiple tests and length of tests and length of treatment time for the patient?
Oh yeah, absolutely. And it is true. The cost of testing up front is, it's not inexpensive.
Right.
Oftentimes insurance covers a portion of it or even all of it. And you do have to be, as a provider, very cognizant on like what you're billing for so that insurance companies will pay for it. And we might loop back around to that because I have some little pieces that might be helpful on like the consumer side when getting evaluations, like questions to ask to make sure like you're getting what you want and that it will be paid for, or the most extent of what will be paid for. But to your point, exactly the cost up front. Oh my gosh, saves, what's that saying? An ounce of prevention is worth a pound of intervention.
Right.
That getting the correct diagnosis, or for instance, so kind of the same root issue, but a kiddo may come in with ADHD and they're really underperforming in school, ADHD and dyslexia are highly comorbid, meaning they co-occur very frequently.
Okay.
Oftentimes when you get testing for ADHD, they're not testing for dyslexia, or they're not doing a full testing for dyslexia. It drives me crazy. I have a whole soapbox I can pull out about it. But if a kiddo is getting services and treatment for ADHD and they have dyslexia, they're also getting, when we put into place the structure educationally for dyslexia, oh my gosh, they absolutely soar. And the treatment for ADHD becomes a lot easier to pursue because the frustration isn't quite there. And then we're also accommodating the need in the language-based learning disabilities. So it really changes the treatment and makes it so much more efficient, so much more effective. I think when we do testing, it often puts us on the most efficient path, the quickest and hopefully least expensive way to get to that space where you're really fulfilling that full potential of all those great things that kiddo or adult has inside of them that makes them feel great and that they can offer the world.
And that's the message for the grandparents that are listening to this podcast. We're talking about lasting change. We're talking about the right diagnosis. We're talking about the right treatment. We're not on, just dropping lines in the water and hope something bites. This is a well thought out plan driven by data and scientific research. We're doing the best case scenario for your granddaughter or grandson so that they can live up to their potential, which is what it says on your website as well. What it should say is so they can live a grand life, but it says live your potential. And but we get that, because grandparents, we don't have time to do unnecessary tests and have unnecessary visits. Mm-hmm. We're still trying to have a little retirement somewhere along the way. But by your approach at Monarch Behavioral Health, you can get the right testing, get connected to the right clinician to get the long-lasting change that you talk about. And that's just fantastic.
Yeah, and to bring, it's one of the most effective things we do that I love doing so much is going into the schools and helping the schools understand what they can be doing to either accommodate a kiddo and their needs, or how to push in and what teaching strategies might work, and putting together those plans. And that really lifts a burden from parents and grandparents in that, oh my gosh, are you at home doing 2 hours of homework every night? You shouldn't be. We should be working in school to make that happen. By the time any kiddo with any type of executive functioning or learning difficulties or high anxiety, behavioral difficulties, or mood struggles, by the time they get home, they're a kid. They need their free time. They need to be doing things that bring them joy and relaxation. They need to be connecting relationally with people. So our hope is also by getting those correct treatment plans in place and structures in school, that a burden is taken off of parents and grandparents, and so that there's more time for life.
That sounds absolutely great. So if a grandparent and a parent are in the midst of your process, getting the right test to determine the right diagnosis, et cetera, how long does it normally take to determine what is the appropriate diagnosis and typical treatment plan for your patient? How long on the average would you say?
That is a great question, because I wish it was like overnight. I wish it was, and especially when people call in like August and are like, we need an IEP in September. And I'm like, it takes a little longer than that. So that's a great question. So when you come in for the intake, oftentimes we try and schedule testing within the next week or two. Once we do testing, we then try and do the feedback within 7 to 14 days. So we can give you the diagnoses and the recommendations 7 days after testing about, sometimes we'll schedule, sometimes it ends up being 2 or 3 weeks just based on people's schedules. And the report takes somewhere between 30 and 60 days to write. It's very comprehensive, hundreds of points of data, and we explain every piece of data in our reports. You don't just get this feed out of numbers. And so the whole process from beginning to end takes somewhere usually between, 30 to 90 days. And sometimes, depending on if we're struggling so we also ask for questionnaires from parents, grandparents, whomever caregivers. We also often get like after school, like if aunts or uncles are watching kiddos, we get their impressions, we get teacher data. And if it takes a long time to get those back, sometimes it stretches to 120 days. So we get all of the data and compile it. And because it is such a big process, it doesn't happen overnight, but we do try to be as efficient as possible.
So that is great news for our listeners, because if you're a new grandparent and you have a new grand family, and now you're raising your granddaughter or grandson at home, and you want them ready for September, they need to be talking to Monarch Behavioral Health right now. Or do you have colleagues, if some of our listeners are out state, and the folks you recommend in Florida or Nevada?
Yeah,
or what have you?
I don't know in like each state, but oftentimes if you look for a program that has a neuropsych training program or a PhD clinical psychology training program, oftentimes those universities have clinics where their students are doing the testing. And then they're supervised by people within the department. And oftentimes that's a great way. And it can also be a really low cost way to go about it. I think you do have to advocate and know what is being tested and exactly what services are included, and also the timeline that they're going to provide you with. But places where training programs, oftentimes large hospital kind of entities also have some neuropsychologists on staff. And so locally here, the University Mary Rackham Clinic is a great place to go, and Beaumont Center for Human Development is a great place to go. Those universities centers oftentimes have really long wait lists. And so kind of balancing your, like the immediacy of what you need in that wait list versus, your own personal insurance or financial situation kind of might bring you to the correct place to get that testing done. But you're really looking for somebody, that usually testing is completed by somebody with a PhD. Something about our profession that I think we need to do better with is communicating and educating kind of the general public on the different types of practitioners and what they do. And I think something that most people don't know is that this type of evaluation is generally completed by somebody who has a PhD or is supervised by somebody that has a PhD. Right. And they have to be very involved. And that's the level of training that you need to conduct this type of evaluation or be supervising this type of evaluation.
So this is not a drive-through evaluation. This is
it should not be. And it should not be just paper and pencil, filling some forms out.
Right.
No. Yeah, it's very in-depth. Mm-hmm.
So you're saying about 90 days to get the final document that would be reviewed between the patient and the healthcare professional. But my point to our listeners is you need to do this now. Dr. Julie said, don't wait till August, where you want to get Johnny in the right program. You want to have a right IEP for him. And I know we're looking forward to school shutting down, but there's a little bit of work that could be done over the summer to really set the grand family up for success. But our guest today on It's a Grand Life has been Dr. Julie Braciszewski from Monarch Behavioral Health. And we hope we can have her back again. I only touched on a few of the questions we wanted to talk on, but you can reach her if you're in the Michigan area at 248-220-3332, or you can find out more about the services they provide at www.mbh-mi.com. And Dr. Julie, thank you so much for being our guest here on It's a Grand Life.
Well, thank you so much for having me.
Thank you for joining us for another It's a Grand Life. Remember to never waste your pain. God can use your situation to bless others even halfway around the world. Be sure and subscribe to It's a Grand Life on our Facebook page, as well as YouTube and any of the various podcast channels that feature the Grand Life podcast. When it comes to raising a grand family, remember the words of the Apostle Paul, who said in 1 Corinthians 13, love is patient, love is kind, it always protects, always trusts, always hopes, and always perseveres. Love never fails. In leading your grand family, it's going to take faith, hope, and a whole lot of love. Please reach out to me. I can be a blessing to you and pray for you, or help you connect to free resources that can make your journey a little easier.